Good day everyone, how are we doing? This is Dr. Aderemi from Mom Health Parenting YouTube channel. Today I'm going to be talking about urinary tract infection in pregnancy. This is particularly important because it is very common. Urinary tract infections are generally common across all age groups, across all sexes, male, female, children. Everybody can experience urinary tract infection. But it's particularly commoner in women and especially in pregnancy. This is because certain parts of our urinary tracts are shorter in women, and so women have tendencies, and because of a lot of other things, hormones, have tendencies to have urinary tract infections. So I'm going to briefly discuss it, and I'm going to tell us what to do when we have symptoms that are suggestive of this. We're going to start with what are urinary tract infections. They are infections that involve any part of the urinary tract. That's simple, yeah? Yes. Parts of the urinary tract, starting from where urine is produced, will start from the kidneys, follow certain tubes called ureters down to where urine is stored, the bladder, and then from our bladder they come out outside our body through a certain tube, shorter in women, and it's called the urethra. These are part of the urinary tract, and any part of this can be infected, and infections could spread across this and even enter into the bloodstream. So how do we know? What are things that are suggestive of urinary tract infections? Prior to this, I'll just briefly run through the causes. What causes this, especially in pregnancy? Well, I've spoken about this several times. Hormones are still the culprit here. Yes, and this is because we need hormones. Our babies need hormones, our bodies need hormones to prepare for this special occasion and everything that pregnancy involves, as well as labor and delivery. So we can't do without hormones. And yes, they cause urinary tract infections. They cause infections in the sense that usually in pregnancy, our urine contains more sugar, more protein, and even hormones. And this, if you are not taking enough fluid, if there's stasis, if your urine is concentrated, can lead to or can be a source of infection. Also, as your babies keep growing, the babies keep getting bigger, they can compress on your urinary bladder. And when they do this, what I mean by bladder is where the urine is stored. When they do this, they can cause the urine that is left in the bladder to reduce, or how will I explain? You don't excrete all your urine, and this can also be a source of infection. So all this causes bacteria, poor hygienic practices, safe sex practices. All this can lead to urinary tract infection. So how do you know? Symptoms would include you have this urgency to pee, you can't keep it, you need to run to the bathroom, you're already raising your skirt, you're trying to sit down, you feel urine already coming out. This whole urgency to pee. You get to the bathroom, you sit down, you're peeing. After peeing, you feel this discomfort, this burning, peppery sensation. You feel like, oh, something is your hurt, you are just uncomfortable, this peppery feeling after urinating. Also, you check into the toilet bowl, you feel this strong odor, this color, your urine is concentrated, cloudy. In fact, sometimes your urine could be bloody. All these things could point to urinary tract infection. You also need to take note of the fact that I said urine is produced in the kidneys, and so you could experience pain in your back, you could have fever, chills, nausea, even as far as your blood volume may reduce because the kidneys too are involved in blood production. So you could have anemia. All this could lead to a sequelae that isn't very suitable, or that could even cause premature labor, premature contractions, and complications in pregnancy. So it's important for us to take note of all these symptoms and for us to go and see a physician. Please don't self-medicate during pregnancy because not all classes of medications are safe for pregnant women. So please see a doctor, call us up on Mom Health, let us know what your symptoms are, let us see you, manage you, and then in 3 to 7 days you are back to normal, depending on how severe the infection is. So please take note of urinary tract infection. It could be small, but it could lead to something really, really complicated. Thank you.
Thank you very much. Please don't forget to subscribe, don't forget to like, and don't forget to share this video. Also, hit the notification button to get more videos like this. You can also visit our website at www.momhealth.com.ng for all maternal and baby products. Guess what? We have a 10% discount for you for all purchases made on that website. Another good news we have for you is you could also visit Google Play Store and download the Mom Health mobile app to explore all our amazing features. Thank you very much.